Still in matters health, uncertainty on the benefits of the new Social Health Insurance Fund, others known as SHIF, has gripped a section of Kenyans, with some looking forward to it, while others preferring retention of the National Health Insurance Fund, NHIF, albeit with necessary improvements. Our reporter Kasichana Masha now unwraps the new Social Health Insurance Fund, comparing the old and the new.
For some Kenyans, the National Health Insurance Fund was just fine.
Nimemaliza kulea ama kupata mtoto mwingine na mwingine, unaona. So, kulingana na changamoto yenye mimi hupitia huku kama baba ama mzazi, bado pia juu ya bima ya mtoto na bibi na mtoto biba mama, sioni ikiwa mbaya, bado juu inanisaidia tu, itasaidia tu familia yangu tu pakubwa.
Wale ambao wanalipwa pesa ya chini ni kama 300, 500 ama saa ingine 200. Kwa hiyo ikiwa unatoa 300 kwa mwezi, naona itawasaidia, kwa sababu hii ya 500 pengine ilikuwa mingi sana, na ukienda hospitali unaambiwa kwanza ugharamia kama miezi 6 alafu kuje utibiwe. Saa akitoa hiyo miezi 6 itakuwa mzuri sana, at least hiyo 300 itasaidia. Yes.
But that's not so for others.
Been improved, but not to be scrapped off. Because scrapping it off and bringing something that is having some other difficulties for us to even access it is a problem. Right now they are saying that people have to re-register. How? They have the details of people who are in NHIF. Why don't they just use those details to bring everything that was in that other system to this system, if they want us to do that?
On October 19, 2023, the President assented into law 4 bills. These are Social Health Insurance Act, Primary Health Care Act, Facility Improvement Financing Act, and Digital Health Act. The Social Health Insurance Act establishes the Social Health Authority to facilitate healthcare services from enlisted providers by pooling contributions, ensuring equitable distribution of quality healthcare at level 4, 5, and 6 hospitals. SHA will manage 3 funds, namely Primary Healthcare Fund, Social Health Insurance Fund, which is now replacing NHIF, and the Emergency and Chronic Illness Fund. The major difference between the two is that NHIF was designed for those in formal employment, but the new fund will be all-inclusive. SHIF will also have a major organized referral system, unlike NHIF, enhancing the quality of care.
And when you have a referral system that is not organized, then you're not optimizing the use of your resources. So the tendency is to want people to go to the lowest level of care and ascend only as required. However, in our current healthcare system, people have been entering at various points, especially much higher than they need to. And therefore, there's need for us to be able to reorganize the healthcare referral system.
In NHIF, the premium was pegged at a maximum premium of 1,700 shillings and a minimum of 500 shillings. Under SHI, those employed will part with 2.75% of their income, with the minimum premium being 300 shillings.
Then the third level, social health insurance, will be funded by contributions by people who are both in employment and not in employment. For those that are not able to afford, government will pay their premiums.
The ministry says this will help increase the number of people who are insured. The scope of benefit has also been expanded under the new scheme to encompass medical outpatient services, end-of-life services, surgical services, specialized pharmacy benefits, medical inpatient and critical care services, as well as accident and emergency services. Other benefits include optical, mental wellness services, specialized essential diagnostic services, renal care services, overseas treatment and dental health care services. The new scheme will also cater for rehabilitative services, screening for common diseases, assistive devices, maternity and child health services, ontology services, and medical imaging services. A major shift in the new arrangement is a fund to cater for health facilities improvement. Funds raised within a facility will be retained for medical services and improvement of its infrastructure.
What we have had previously is where money is raised from a health facility, patients pay for services, money is collected, but it is invested in other areas that are not health areas. That is why we have this Facility Improvement Financing Act, so that then
one can enjoy the benefit after being a member by registering via mobile phone through USSD code *147# or website on www.sha.go.ke or under the guidance of a community health promoter. Kasichana Masha, Legends Edition.